I'm Dr. Karen Hoffman, and I'm here today to explain to you what periodontal disease is and to show you that you too can brush your pet's teeth every day to help prevent it. We all know what cavities are, but we say, what is periodontal disease? The way I think of it is like this. You buy a brand new house. It's nice, it's in good shape, working perfectly. Over time, termites may start to invade your house. Initially, they're on the outside, but ultimately, they get down into the structure of the house, what's holding the house up. If you do nothing about this infestation of termites, the house will eventually fall over. The termites are the plaque and the mineral laid down by bacteria, and that allows the bacteria to go deeper and deeper and deeper, and when the house falls, the tooth falls out. But there is help to the rescue in our little rowboat. We can brush to get rid of these termites. I just want to show you that periodontal disease is the #1 disease of dogs, #1. And just like the house and termites, if you don't take care of the teeth, it eats and eats away this bone, and the tooth gets, well, there's one that fell out. The tooth gets looser and comes out. And this is exactly the size of a canine tooth. There's more underneath than what is seen on top. So, now we're going to introduce our guest star, Boozer, who's going to let us show you how you too can start brushing your dog's teeth. Okay, the first thing you do with your dog is you get him or her used to having the mouth touched. Boozer, Boozer, come on, Booze. So what you can do, well, we'll give him one little treat, and then I put those aside so he doesn't know. What you can do is you just touch their face and you stick your fingers in there, move it all around, okay? They get used to having their mouth touched. Then you have to decide what toothpaste you're going to use. We have a poultry flavored toothpaste here. I'm going to squirt a little on my finger and let Boozer lick it off. Okay? And over time, Boozer's going to love the toothpaste, and I'll use my finger to just rub it on his gums, get him used to the taste of it. Okay? Now we have to pick our toothbrush. Dogs' mouths are not straight back like ours. They are angled. So you want to use an angled toothbrush. These are available at our hospital. We also have a smaller version for small dogs and cats, and you must use nylon soft bristles. So, Boozer is now ready to have his teeth brushed. I am left-handed, so I'm going to hold Boozer with my right arm around, okay? Lift up his lip and just start gently brushing in circular motion, coming from the back to the front. Go to the bottom and do the same thing. When I get to the front, I'm going to go up and down. It's very important to have the bristles of the brush meet with the gum line. This is where the bacteria lay. It is also important to have a cup of water to keep rinsing to get rid of the plaque that's already on the brush. I'll add a little more toothpaste, and then I'll come around to this side. And again, we'll lift Boozer's lip up. And we'll start here. See how I'm at the gum line? Going forward, going forward. We go down here. Here's his teeth on the bottom. getting them in the back, going on the gum line, and then when we get to the front, same thing, we go up and down. Okay? And then we give Boozer a treat because he's been a good boy. Find a place in your house and make this a daily habit. If you don't do it every day, you'll start skipping and going twice a week, then once a week. And like us, they need their teeth brushed every single day. A few more important facts. Thank you, Boozer. That people often say, my dog had a dental 2 years ago. Why is his mouth bad again, doctor? Well, in 20 minutes after a cleaning, plaque is already forming on your dog's mouth. And in 3 to 5 days, a mineral can form on your dog's mouth. So it is not like having one dental cleaning once is going to be enough. If you start with a clean tooth and you do daily brushing, you can really help prevent the disease from progressing and your dog losing teeth. Don't try doing it on a diseased tooth covered with plaque and mineral, because that could hurt, cause bleeding, and not be comfortable to your dog, and it won't get it off. What is gingivitis? Inflammation of the gums. How do you know if your dog has that? Touch the gums. Are they red? Do they bleed? Are they swollen? Does your dog resent you touching them? These are all signs of an inflamed gingiva. Also, hard food, doctor. I feed my dog hard food so that he won't get dental disease. Well, hard food is not really chewed very well by dogs. They mostly throw it to the back of their mouth. So they are not using it in the way it's made to really chew it this way and therefore get down into crevices. So please take time when you have a puppy. Their baby teeth don't fall out totally until 6 months, so you don't need to brush those. You just need to get your hand in there, get them used to the toothpaste. Their teeth, just like a baby's, when they're teething, can be a little sore, but once they've gotten their adult teeth in, you start with the once-a-day toothbrushing. And for those of you who have had to undergo having teeth removed from their dog, they realize how very expensive it is. So, start brushing.